All right, I'm here with Dr. Julie Foucher, and I'm so excited to have you on our podcast today. So, welcome.
Thank you for having me. I'm excited.
Yeah, so I love to start out with your story because usually we have either a pain to purpose story or something that you're super passionate about, and I love learning that about people. So, tell us how you sort of got into what you're into today at Wild Health.
Sure. Well, it's a long story, but I'll give you the short version to start. I am a primary care doctor, so a family physician. But when I was in the process of applying to med school is when I first found CrossFit. And that I ended up competing in CrossFit for several years during medical school. And that really completely changed my perspective about health and about even how I wanted to help patients and direct my career in medicine. I think when I started embarking on this career in medicine, I was very naive. I didn't really realize all of the chronic disease that we're facing as a nation. And as a world, really, I didn't really realize how challenged our healthcare system is and really creating health. But doing CrossFit and then learning about the power of exercise and nutrition and learning about how big the burden is of chronic disease in the world that we live in, it really directed my path towards family medicine. And so I ended up going to the Cleveland Clinic for med school and residency, and I was very lucky there to be exposed to functional medicine early because of the Center for Functional Medicine that was started there by Mark Hyman. And so knew pretty early on I didn't want to practice in a traditional setting. I wasn't going to be the kind of doctor who was going to be happy doing 15-minute visits and writing a lot of prescriptions. I really wanted to help my patients improve their health and address the root causes, which were largely lifestyle related. And so after I finished residency, I was really lucky to find Wild Health, which is a precision medicine practice. So we really look at each patient as an individual. We use a lifestyle first approach, very fitness first approach. All of our doctors and health coaches are actively participating in CrossFit or another fitness regimen, and we really practice what we preach. And for every patient, we come up with a very personalized plan in every area of their health and lifestyle. We use their genetics, we use labs, we use wearable data, we tailor things specifically to their goals, and work closely with a patient and their health coach in order to optimize their health. So that's why I'm here.
Oh, that's awesome. So I have done a little bit of CrossFit myself, and I learned about CrossFit back when I was really big into paleo back in like
Okay.
2013. So when
Mm-hmm.
you said that CrossFit had a huge impact on your learning, my mind goes to like, oh, were you exposed to like the paleo people? Like, tell me about that impact that it had on your progression as learned about medicine.
Absolutely. Great question. Because as you found out about CrossFit through paleo, I found out about paleo through CrossFit.
Yeah.
So the reverse is true.
Yeah.
I first started doing CrossFit when I was in undergrad. I was starting to apply to med school. And at that time I thought, I really want to be a specialist in medicine. I thought, let me just understand one part of the body really well. And I'd always been kind of a perfectionist type. The idea of being broad was a little bit overwhelming to me. But I was sitting in my CrossFit Level 1 seminar, which is our introductory seminar. We teach the methodology and the reason behind why we do what we do. And there's a particular model that CrossFit teaches for health called the Sickness, Wellness, Fitness Continuum. So it's this idea that all of us sit somewhere on this continuum from sickness to wellness to fitness. And our healthcare system is really good at keeping people well, right? Like we can keep your numbers in a quote unquote normal range, often with medications. But then when something happens, say we get an infection, we get in an accident, something unexpected happens, we don't have a very big buffer between where we are now and being very sick. And we don't have a lot of resilience in order to be able to handle those types of challenges. And so what we do in CrossFit is all about building that buffer. It's all about trying to move people as far to the fit side of the continuum as we can. And that means trying to improve performance markers. So whether it's your mile time, someone who maybe is well could jog a mile, someone who's fit is going to run a mile in, 5 minutes or something like that. Someone who's sick probably can't even walk a mile. Same thing for, deadlift. How much can you pick up off the ground? Can you pick your groceries up off the ground? Can you pick your grandkids up off the ground? If you're very fit, you might be able to pick a few hundred pounds up off the ground. And same thing goes for all of our health markers. So, like a lot of your listeners will be thinking of like hemoglobin A1C or fasting insulin. the numbers that you're seeing on your CGM, those can all be optimized. And the more optimized they are, the more you are on that fit side of the continuum. So our goal in CrossFit is to try to push everyone's performance and health markers to the fit side of the continuum so that we have this buffer against disease. And for me, that was a big light bulb moment where I realized, wow, this is really how we create health. And it was very eye-opening to me because then I started medical school. And during my first and second year, we were spending a lot of time in primary care offices. I'm learning the basics of, medicine and the exam and taking a history. And I'm seeing that patients are coming in, they have high blood pressure, they have prediabetes, they have high cholesterol. We talk to them about nutrition and exercise, but then we don't see them for 6 months or a year. And they come back and usually their numbers are worse. And then they get prescribed a medication. And it kind of goes along in that cycle. And the system to be able to deliver really good root cause, lifestyle first care just isn't set up in our healthcare system. It's hard to help people change their lifestyle with a 15-minute meeting every 6 months or 12 months. And on the flip side, I was spending a lot of time in CrossFit gyms. I was training a lot in the evenings and on the weekends, and I was seeing people really dramatically improve their health. They were coming off their medications, they're reversing their chronic disease, reversing their insulin resistance, they're gaining confidence, they're doing things they never thought they could do before. And so it just opened my eyes to say, wow, we're really approaching this the wrong way. And if we want to create health, that's going to be done in our communities. That's going to be done in the places where people are spending their time on a daily and weekly basis. And so that's really where my passion for, family medicine, good primary care, combining fitness and primary care came from. And the more I got into CrossFit, the more I learned. I think my first exposure to paleo was through CrossFit. I did a Whole30 back in 2012. And that was the first time I had really, cleaned up the quality of my diet and noticed a big improvement myself in even just how I could think better and how I felt better. I performed better. And then I remember being exposed to, I had heard of functional medicine, I think through maybe hearing Chris Kresser's name, but it was in 2014 that Mark Hyman came and gave a presentation at the Cleveland Clinic about functional medicine. And I wasn't, it was sort of out of my way to go. It was like across town really early in the morning, but I had seen an email about this and I thought, okay, I don't even know who Mark Hyman is, but I'm just going to go to this presentation. And it turns out that it was him announcing the Center for Functional Medicine at the Cleveland Clinic. And he described, this is what functional medicine is. This is how we do a systems approach to medicine. And it was another light bulb moment, kind of like my CrossFit level 1, where I thought, wow, once you see this, you can't unsee it. And this is how I want to practice medicine with my patients moving forward.
I love that. And so can you tell us about what that systems approach is, what functional medicine is compared to the traditional, would it be allopathic medicine?
Sure. Yeah. I think so. There's so many different words for all these things now, but I think the thing that really drew me to functional medicine is that you are looking at the body as a whole system. So in traditional conventional medicine, you have experts in each body system, right? If you have a heart problem, you go to the cardiologist. If you have a GI problem, you go to the gastroenterologist. If you have a skin rash, you go to the dermatologist. But in reality, there could be one root cause that's causing different symptoms in different people. So say you have celiac disease, one person might end up in the dermatologist's office because they have a rash, whereas another person might have a lot of, GI symptoms and they're in the gastroenterologist's office. But functional medicine is saying, let's look at all of these symptoms from all the different body systems and try to identify what's the root cause of those and optimize each of our systems because they're all really working together. All of these systems are not acting in isolation. They're all part of how our bodies function. And if we have imbalance in one, it's probably going to cause imbalance in other, especially our nervous system, our immune system, they're really integrated through all of these different systems. So that's the approach of functional medicine, is really getting at that root cause.
Yeah, that's helpful to know. And I am a functional nutritional therapy practitioner. It's a mouthful, but we learn the same thing, just more for nutrition. And we talk about digestion and the gut being really at sort of the center of that. Plus we look at fatty acids and mineral balance, blood sugar, nutrient dense whole foods diet, hydration. And so we optimize those things. Those are considered the nutritional foundations, and everything sort of falls into balance. And we have to I personally throw the adrenals in that category as well, because we could be a total stress case and then or have a lot of, stressful situation happen to us, and that's going to impact our digestion. It's going to impact our blood sugar. So it can deplete us of our minerals, as we're stressing out. So
Absolutely.
we look at all those things together, and that's been really profound in helping my clients heal. So I can't imagine, taking it to a medicine perspective as well, looking at other areas. So tell us a little bit about, I tend to throw doctors under the bus a lot, just because I get a lot of clients who come to me, or followers and people who are listening to the podcast, and they're telling me my doctor has failed me. They're gaslighting me. They're not listening to me. They just want to send me an anxiety medication, and or that, like, I have all these problems and they're saying nothing's wrong, or, oh, my thyroid's fine, but I still XYZ. And so I feel like you said, they're looking for the presence of disease. But what else do you think that the mainstream, like, what is contributing to this? Because I know that a lot of people like yourself got into medicine probably because you wanted to help people. And so I feel like a lot of that is lost along the way. So is there some sort of like culture of medicine that's sort of impacting things? Like, what do you see from your perspective on the inside?
That's a great question. And I can feel a lot of your, frustration, your clients' frustration. I think that, I think you're right. I think most people who went into medicine really did it because they wanted to help people. What I've seen from even my short time in medicine and seeing people go through training and then go out into practice is that the system is not set up well in order to be able to feel like you're truly making an impact in people's lives. It's not always the case. I think there's so many life-saving things that happen in medicine and so many incredible, advances and things that can be done. But especially when it comes to a lot of these lifestyle related diseases, it can be really frustrating because how we're trained in medical school is not a functional medicine approach. It's very much we learn in the first couple of years of medical school all the biochemistry and all the physiology and how the body works. But then when you get out into practice, it largely falls into, how does this work from an insurance standpoint, which means you need to have a diagnosis and you need to have a treatment. And so it's, okay, what symptoms does a patient have? What are those symptoms? What do those fit into? What diagnosis does that fit into? And then what's the treatment that's written in the textbook? So if you have, depressed mood and maybe you're having trouble sleeping and maybe you loss of interest of activities that you used to enjoy, that falls into, the category of depression. And the treatment for that, the first line treatment is probably going to be an SSRI, something like Prozac. And so that would be the treatment that you would get. Whereas if you're taking a functional medicine approach, you might ask more questions to understand why those are happening. Maybe it's related to, what you're eating. Maybe you recently had some like a concussion or some trauma or something else that's contributing to those symptoms, nutrient deficiencies, who knows?
Mold
And
exposure.
addressing
Yeah.
those. Yeah. And addressing those so that you can help people restore balance. I think that the way that the system is set up also is that it's really putting a lot of pressure on doctors to be able to see a lot of patients in a short amount of time, which doesn't allow a lot of time to build relationships and personal connections, which is really what makes this so rewarding. So that was a big driver for me, knowing right away I didn't want to practice in that system. I wanted to be able to feel like I could really hear my patient stories and understand them and be there for them and build longer term relationships. And so I think that's a big part of why we're in this mess. I think that, most doctors are not, they're not malicious. They're not trying to harm you if you feel like you're not getting the information that you need. I think that the educational system isn't set up the way that the system is set up in order to see patients in the time that you have and the tools that you have, just is not ideal. And so I think that's something that we're all fighting and all trying to improve. I am very encouraged by this younger generation of doctors coming up through medical school right now, because I think because our culture and our society has such a increased focus on health, patients are asking for change. I think doctors are asking for change, medical students are. And so I I'm always hopeful and optimistic that we are moving in the right direction. It's just always a bit slower than everybody would like.
Yeah, I hear that, and I'm hopeful to hear you say that, because I do think that, in all the messages that I get that are saying negative things, there are a handful of messages that I get saying like, "Oh, I was able to get a fasting insulin test from my doctor," or "She actually recommended it to me." It's like, "Yay. Oh my gosh, that's like it's groundbreaking," you know? And so there are these little things where you do see, and I think that people, I don't know if you would recommend this, but I feel that we might need to be advocates and ask questions, and like I heard that testing fasting insulin would be important, but it's like you have to go in there and have to know these things, because they can get shut down
Mhm.
really easily. And
Mhm.
especially in the framework in which doctors are taught, and the way that I just feel like they're in this like stranglehold from the insurance companies. It's like, if you don't have a diagnosis, they can't do anything for you. So
Mhm.
people whose blood sugar is crashing, they're feeling like they're going to pass out, and their blood sugar is 90, and the doctors are like, well, your blood sugar is not low, but we know that it's an actual, the body is experiencing this energy crisis. You have such metabolic inflexibility that you're feeling like your blood sugar is crashing. The doctors can't do anything for them. They can't get them a CGM, because they're like, what am I going to put this under? So it's like, you're not hypoglycemic, your blood test showed that it's like 95. So this is happening, and they're so stuck, because my clients are so stuck because they're not getting the help. But it's good to hear that there's some change in the newer generation. And I think that the way that I don't know, I know my social media is obviously very rigged towards health and wellness, but I hope that this message is getting a little bit more out into the mainstream, so that if someone hears about this in college, they're like, oh yeah, I went to the gym, I went to CrossFit, I heard about
Mhm.
paleo. They're already thinking of these things, and then once they go into medical school when they're young, they might have a certain mindset already, like, oh, I knew this much before I came in. So I think that even just that little bit, like you were exposed to, might help a lot more future doctors be exposed to a different way of thinking than is currently there traditionally. So, yeah.
Yeah, absolutely. And I think just having, like you said, having those experiences first and then having the curiosity. I think so many doctors are just so overburdened, like they don't even really have time to keep up with the latest research and new findings, because they're being asked to see patients every 15 minutes all day and then do tons of paperwork. And so they're exhausted, and then maybe if you ask them, can you order a fasting insulin, and it's something they're not familiar with as a standard, thing that they would order, it might just be too much because they're super stressed out. And the rates of burnout are incredibly high,
Mm.
especially in things like primary care. So yes, I think finding a doctor who is, open-minded and curious, and even if they don't know all the things that you're bringing to them, if they're willing to like listen and to consider and be curious about it, I think is a good partnership. And again, that's why, I've been really grateful to work with Wild Health, because it's really like-minded physicians who have said, you know what, the traditional system isn't working for us and we want to do something different. And it's just a great, very refreshing environment to be able to work in.
Yeah, that's awesome. So can you tell us a little bit about what makes Wild Health different?
Sure. So we are a precision medicine practice, and we do primary care as well. So precision medicine means that we look at each patient as an individual. So similarly in your traditional system, how you get, a diagnosis and a treatment that's standard for everybody based on large randomized controlled trials, we realize, everybody's different and people are going to respond to things differently. And there's a reason why, some studies, every other week you hear a different study, like caffeine's good for you. No, it's bad for you. Vitamin D, yes or no. And conflicting, because there's so many different unique people that are included in those studies. And so we start, for every patient, we look at your DNA. We look at a very comprehensive lab panel that includes things like, your fasting insulin and your CRP and micronutrients and hormones. And then we ask really detailed questions about your history, your lifestyle, your goals, your family history, medication, supplements, all of those things. And we pair each patient with a doctor and a health coach. And our health coaches are all amazing. They all have different backgrounds. Some of them have medical backgrounds, some have more fitness backgrounds, but everybody is trained in precision medicine and brings really unique insight to the table. And so when you come on as a patient, you first have an appointment with your health coach just to get to know you and understand your goals. And then once all of your information is back, your DNA and your labs, we produce a health report for you. So this is based on our algorithm, which takes into account your DNA, your labs, your questionnaire data, and gives you personalized recommendations in a number of different areas. So lifestyle areas like nutrition, exercise, sleep, neurobehavioral, which is things like mood and mindfulness. And then we also look at chronic disease prevention. So we have a whole section on insulin resistance, inflammation, heart disease prevention, Alzheimer's prevention, and on longevity as well. And this is usually somewhere upwards of 45 or 50 pages. It's a lot of information, but that's our roadmap moving forward. So then we sit down and we have an appointment with you, your health coach, and your doctor. And we just go through and say, well, okay, these are what your goals are. If your goals are, to run a marathon in 3 months, our approach might be very different than someone whose goals are to be able to play with their grandkids, in 10 years. And so we look at, okay, here's your goals. Here are the couple of interventions that we think, and we all three agree on, are going to get you closest to your goals. And we decide how we're going to approach those. And then we also choose our outcome measures to track. So everything that we do is very data driven. And we want to make sure that we have some way to know if what we're doing is working. We don't want to put you on a whole list of supplements and just hope that they're doing something. If we put you on a supplement or we ask you to make a change to your lifestyle, we want to have an outcome measure so that we know that what you're doing is actually moving us closer to where we want to be. So for someone who's maybe struggling with insulin resistance, who has early signs, we may look at your hemoglobin A1C. We may ask you to get a CGM and work with you on that. We may look at your CRP if that's elevated and decide what those outcome measures are going to be and what our interventions are going to be. And then we just iterate on that over time. So you'll meet with your health coach and then we'll repeat labs and check those outcome measures. And we'll just keep working forward on that, process of optimization over time.
That's awesome. That sounds great. And I do not currently have a doctor. So I'm like, I think I need to
well,
sign
come
up.
check us out.
Yeah, for sure. So yeah, because I'm so turned off from the mainstream system and, it's hard to doctor shop in today's world. You kind of have to go by word of mouth and I found out from you guys about a close colleague in the space. So, it's nice to get those good recommendations. So
Totally.
Switching themes a little bit to metabolic health. So this show's about blood sugar. We talked about insulin stuff. Can you tell us some of those markers for metabolic health besides, you said the A1C, maybe you can talk a little bit about why these measures are important, like CRP for people who don't know why that would be important to test?
Sure. Yeah, we check sort of as a standard for most of our patients when they start. Well, we have the option, you can do a more comprehensive lab panel or a more limited lab panel, depending on how you want to start. And then we'll kind of make specific recommendations from there on what we think would be most helpful. But we certainly look at inflammation or CRP. So CRP is a general marker of inflammation. If it's elevated, it doesn't tell us why you have inflammation. Like I said, there could be a number of different root causes. It could be stress. It could be something as simple as you have an infection or you did a really hard workout the day before, or it could be stress, lack of sleep. It could be diet related. Often, one of the most common causes of elevated CRP or inflammation, chronic systemic inflammation, is actually insulin resistance. It can also be inflammation coming from the gut, from intestinal permeability or changes in the gut microbiome. So those are all things that we take into consideration if we see an elevated CRP, and then we just sort of work through those to identify the root causes and address those. We also look at a couple of other markers of inflammation too. We look at one that's called LPPLA2, which is a marker specific to inflammation in your blood vessels. So that's a great one to give us information about what might be going on in your blood vessels and your risk of cardiovascular disease.
Can you say that slower so I can jot it down? LPP2A, was that it?
LPPLA2.
LPPLA2. Got it.
Yep. And then we look at a very comprehensive lipid panel. So in a more advanced lipid panel, looking at particle number and particle size and different lipoproteins that give us a good picture of your cardiovascular risk, in addition to looking at your genetic risk for cardiovascular disease based purely on your genes, plus your family history. We also look at a risk calculator called the MESA, which is a clinical risk indicator. So we can input there, your clinical risk factors, things like your cholesterol, your blood pressure, your age, your family history. If you've ever had something called a coronary artery calcium score, which is an image, we can put that information in there too. So overall, we're looking at, every piece of information that we have to tell us about your cardiovascular health. And then any areas that we see we want to optimize, that's where we'll target our efforts. So those are some of the big areas. We are also looking obviously at methylation. So homocysteine is a marker of methylation. That's important for metabolic health and prevention of chronic disease. So we do a lot of work there as well. We have a whole section of the report dedicated to methylation.
So, would you be able to give us some tips for people that you might see who are having issues with methylation, who have the MTHFR mutations like myself?
Totally. Totally. Yeah. So there are a lot of different genetic SNPs related to methylation. And THFR is probably the one that you hear most commonly. But methylation is, in general, it's an important process for our body. It's important for being able to turn on and off different sections of DNA or activate different proteins. And we find that people who struggle with methylation are at higher risk for things like heart disease, Alzheimer's, other chronic disease. So it's something that we want to make sure is functioning really well. And in order for methylation to function really well, there's sort of two different pathways that we look at. One is we need B vitamins, and specifically, for people who have genetic mutations there or genetic SNPs, we need methylated B vitamins. So like vitamin B2, B12, B6, those are all implicated in that pathway. And so if you have one of those SNPs and maybe you're taking in B vitamins, but they're not methylating well, that means that you might benefit from taking a methylated B vitamin as a supplement. So that is a place that we may start. Or we may start, depending on, what your genetics look like, we may start just by having you increase foods that are higher in B vitamins. So whether that's, the green leafy vegetables, red meats, eggs, organ meats, things like that would all help improve your B vitamin intake. I also look at whether or not you're absorbing. So you may be taking in the B vitamins that you need, but you might not be absorbing well if there's something going on in your gut. So that's something else that we look at too. And then the other side of this pathway is the choline pathway. And that is, that comes from dietary protein. Specifically, it's really high in things like eggs and fish and green leafy vegetables. And if you're not getting enough choline, or if you have some higher genetic risk for needing more choline, then we may address that with a supplement. So a common supplement that we'll use there is called betaine or TMG, trimethylglycine. Or even creatine is another good supplement because it frees up your body's choline stores as well. So those are some of the things that we might try. And we generally try to have a food first approach. So trying to increase those foods. If we're not seeing improvement or if we have really high genetic risk, then we go to the supplements.
I love that. I like that food as medicine premise. And we see this happening all the time. So circling back to metabolic health, what do you see food wise as being something important that you've seen results with your clients or patients?
Yeah, when we look at nutrition, so we start with, basic recommendations that are going to be true for almost everybody. Then we get into the details of what does your specific DNA tell us about how you might respond best. And then what are your current labs look like and your other, symptoms or your phenotype look like? And we take all this information together. We're not going to make recommendations solely based on your genes. If you're otherwise, you look great, your body composition is great, you feel great, your labs look great, no need to change something up just because your genes suggest that you may do better there. But the recommendations we start with for everybody are, number one, eat real food. I think, you and your listeners are well aware of this, but it's eating real food, avoiding processed food, avoiding processed oils, trying to stick to things like extra virgin olive oil or avocado oil, and then looking at your fasting window as well. So I think for most people, at least a 12-hour period where they're not eating at night is going to be really helpful. And ideally, we'd like for at least 2 or 3 hours at night before you go to bed to stop eating to help improve your sleep and your circadian rhythm. And there are a lot of different SNPs also that predispose you to struggling with sleep or putting you at higher risk of things like cancer and Alzheimer's disease if you have disruptions in your circadian rhythm. So that can provide some additional motivation for people.
Yeah.
For people who are really struggling with, metabolic syndrome, we might recommend a larger fasting window. I think, I tend to do that in people who have metabolic syndrome, or more likely in males as well. I think with females, you have to be careful, and also have to be careful of, like you mentioned earlier, sort of the stress axis as well, because fasting is another stressor. So that's what we start with. And then we can look at your specific genetics. So let's say you have some insulin resistance. We can look at what your genes tell us about your likelihood to tolerate fat, carbs, and saturated fat in your diet. And if you have a really high carb intolerance, obviously we're going to first look at the type of carbs you're eating, but then maybe decrease your carb intake overall. I also see sometimes that saturated fat is implicated in insulin resistance. So if you have a really high saturated fat intolerance based on your SNPs, like maybe there are these SNPs called FTO SNPs. If you have a bunch of those, or PPAR alpha or PPAR gamma, and you have a very high intolerance to saturated fat, and maybe you're cooking with coconut oil, or you're doing a bulletproof coffee in the morning and getting tons of saturated fat that way, that may be something that we address and actually then see improvements in your insulin resistance. So that's sort of the approach that we're going to take for somebody who's got metabolic syndrome or insulin resistance, and take into account their genes and their labs.
I love that. That's great. And I like the idea of, or I think it's really interesting, this idea of carbohydrate or saturated fat intolerance. Can you speak a little bit more, like how do you measure, for example, carbohydrate intolerance?
Sure. So this is part of our algorithm. So we basically, we have an algorithm that pulls in, based on the latest research, the genetic SNPs, or single nucleotide polymorphism. So these are just little variations in your genes that maybe put you at higher risk for not tolerating, if we're talking about carb intolerance, for not tolerating carbs as well in your diet. Meaning, if you eat a higher carb diet, you're more likely to develop insulin resistance. And so we've pulled all of the SNPs from the literature that have good research around them. And then we look at your specific SNPs, your specific risk, and then we summarize those to determine how carb intolerant you are. And that just helps us create hypotheses. So, none of this is set in stone. Ultimately, it's all about the N of one experiment that you do yourself. But if we look at your genes and we say, wow, you've got a really high carb intolerance and saturated fat intolerance, why don't we decrease your saturated fat in your diet a little bit and decrease your carbs, or change up the quality of your carbs, and then let's retest your labs and see where you are in terms of insulin resistance. And we
Yeah,
do the same
that's
thing for just fat in general, and then saturated fat and carbs.
very interesting. Yeah, I'm very like a pro fat person because I feel like fat is really helpful, but
Mm-hmm.
it's interesting that, the saturated fat, it's not, I feel like the mainstream just really like shit all over saturated
All
fat.
fats, yeah,
And
totally.
yeah. And so it's like, well, that's a really healthy fat to cook with, and they're not that bad. But I understand that there's this bio individuality when it comes to tolerating different types of fats. So I
Mm-hmm.
think that just from a listener's perspective, um, if you're not there yet to test with Wild Health, that it could be a good experiment if you're experiencing maybe like weight loss plateaus or just not feeling as well, to switch out the types of fats that you're having. So
Mm-hmm.
this would be falling into more monounsaturated fats, like you mentioned, avocados, olives, coconuts are mostly saturated fat. All fats are combinations of these different types, but we're talking about the ones that are sort of like the heaviest hitters. And then
Mm-hmm.
I would say fatty fish would be a really great source of fat that's not as saturated. And I tend to like all the saturated fats better, or
They're
like the
good, right?
most. So yeah,
Yeah.
yeah. I hope that doesn't
Yeah.
come out on mine.
I know. Well, it has been, I think, really cool for me to see as I'm working with patients and see how this plays out. And I think that, there's a reason why you hear there's so many different diets out there, and everybody swears by theirs, right? Like there are people who respond really well to a keto diet, and then there's other people who feel really great on more of a like Mediterranean, vegetarian with fish type diet, pesco, I guess you can call it pesco Mediterranean,
Mhm.
Mediterranean diet. And there's a wide range. And the reason for that is probably genetics. The more we're learning about nutrigenomics, everybody has their unique ways that they respond to different types of food. And so I think just being open to that and realizing, like, not getting frustrated if you're like, gosh, everyone else is doing so great on a keto diet. Why am I not? Or like, why do I not feel great on it? It's just about finding that optimal diet for you. And it's a process of self-experimentation. It's doing something, having an outcome measure, tracking your symptoms, and then making a modification, and eventually you'll get to that optimal diet. But we find that by using genetics, we can get there a little bit faster because we're able to make more educated guesses about what might work best for you.
I love that component because I'm very pro experimenting with your diet. And I
Yes.
also talk about that our needs change over time. So do you see that too,
Mhm.
that, sometimes this is working and then you need to sort of vary things up, whether it be like cycling carbs, cycling fasting, or does that come up for you as
Totally.
well?
Absolutely. I mean, I think different stages of life, especially for women, we have so many different stages of life and hormonal changes. I think that there are so many different factors. And like you mentioned with metabolic flexibility, in order to have that, we have to expose our bodies to different stimuli, So it means if we ate the same exact diet at the same exact time every day, our
Mhm.
bodies aren't going to know how to adapt. So there is some value there in changing it up and helping your body be able to adapt to different stimulus.
Yeah, love that. So you mentioned this one thing earlier, and I feel like it comes up a lot, but can you talk to us about caffeine? Because I feel like that is one topic that it's like, it's good, it's bad, it's good for some people. I know personally, if I have caffeine, I get a spike on my CGM. I can't tolerate that much of it. I know that I'm like a slow metabolizer of caffeine because if I had some
Mhm.
at like 3 p.m., it would delay my sleep. So can you talk
Totally.
to us about that?
Absolutely. Yeah, we look at caffeine SNPs for all of our patients. So one of the most common ones is CYP1A2, which is your caffeine metabolism. And so you said you have slow caffeine metabolism. Some people have faster metabolism. Some people are more intermediate. And that just really helps us, again, to make some educated decisions about how to experiment with this. So somebody with slower caffeine metabolism, we might try going, decreasing the total amount of caffeine. We might try cutting it off earlier in the day, looking at maybe our sleep tracker as a way to see how that's impacting us in an objective way, looking at how we feel. Um, Interestingly, people who have that fast caffeine metabolism SNP tend to respond better to caffeine for athletic performance. So you hear about caffeine as a performance enhancing drug for, athletics. And it turns out it might not actually be in all athletes. It might just be in these athletes who have fast caffeine metabolism. So that's a good thing to know and experiment with if you're, really interested in optimizing your performance. But I think doing the experiment for everybody, it's something I've done, multiple times, is trying to go without caffeine and sort of detox yourself from caffeine and then see how you feel and monitor your symptoms. And then playing with, if you're adding it back in, how much and at what time you cut it off during the day. And it doesn't always line up. Some people have the SNP that says they're a fast caffeine metabolizer, but they don't feel that way and they feel like they metabolize it really slow and it affects their sleep. And so they decide not to have it. So it's all about that experimentation.
Yeah, that's really interesting about having it as a pre-workout, part of a pre-workout. And I've recently been experimenting with ketones pre-workout. Have you done
Mm.
that? Have you done any exogenous ketones?
I have not done exogenous ketones yet. I did do a ketogenic diet, very strict, for 12 weeks a couple years ago and played with that, which was very interesting. But I've not tried the exogenous ketones yet.
They're
And
it's
also,
really awesome.
oh, go ahead.
No, I'm sorry. The delay always gets me. I always cut people off. But yeah, it's surprised me because I tried certain ones that didn't work well. And I
Huh.
tried another brand, this brand called Kinetic, and
Okay.
the chain, I mean, it was so different. And I feel
Wow.
like it's how I want caffeine to make me feel, but it doesn't make me
Hmm.
feel like that. So yeah,
Totally.
it's something cool to play with.
Totally. And just to clarify about that CYP1A2, that it can be performance enhancing, but only if you use it when you need it. So if you're using it every single day for training as a pre-workout, it's probably not going to have the impact versus if you save it for before a competition. So if you're more caffeine naive, you can use it that way. And there's also another SNP called Adora 2A, which increases risk for anxiety and altered sleep with caffeine. So that's another one. If you have that, or if you have high risk alleles there, that you might want to stop your caffeine consumption earlier in the day.
That's really helpful. And when I talk a lot about caffeine reduction for improving blood sugar, and especially for my people whose blood sugar is crashing all the time, and we know that they have this adrenal component, that the caffeine is kind of just borrowing from tomorrow's energy. It could be,
Mhm.
based on your genetics, it could be stressing out your body. Coffee is very highly sprayed. So if you're not doing organic, there's so
Totally.
many potential issues from it. But a lot of people find that they just have so much better energy when they get off of it. It feels like counterintuitive. It's also really dehydrating. So, I mean, like the list
Yeah.
goes on with
I
caffeine.
feel the same way. You're actually inspiring. Maybe I should do another caffeine detox because it's been a while, but I always felt so amazing. Even when I did it during med school on some of my, like my surgery rotation where I'd have to be up super early in the morning, but I always felt so awake and my energy felt so much better throughout the day. And I lately have been getting into more like mushroom coffee and things like that, which I think are a great alternative if you feel like you want something later in the day, but not to have all the lasting effects of caffeine.
I love that. Yeah. And I really like this stuff called Rasa. It's a coffee alternative, and they're adaptogenic
Mm.
herbs that help boost the
Ooh.
adrenals. So it gives you this like actual natural energy. And then over time, it's kind of like a supplement that's helping to give your adrenals that little boost every day. And it could be a really great coffee replacement. But one thing I do recommend, and I don't know if you recommend this as well, but I always recommend to slowly wean off of caffeine, because
Mhm.
the withdrawal is just so real and the
It's very
symptoms can
real.
be so intense and heavy. Like I had the only migraine I've ever had in my life was when I tried to get off of caffeine, and I was even slowly weaning
Mhm.
myself off. So it can be really intense. And then also, I've heard stories where people, they use the bathroom after they have caffeine and then they stop
Mhm.
having it. And there was a story that, I mean, I heard this in college. I don't even know if it's true, but some girl had like kind of like fecal impaction because she wasn't going to the bathroom because she wasn't drinking coffee. Like that just freaked me out and kind of stayed with me. I don't know if that'll actually happen. But I mean, just go slowly. The body likes slow changes anyway, instead of just
Yeah,
like, hey, I'm going to cut you off. I'm going from 3 cups a day to none. Like it'll be rough. So just
I
ease the
agree. Yeah,
burden.
I'm always a big fan of doing things very slow and methodically, and nobody needs to like suffer for 3 days just to get off caffeine. You can take your
Ex-
time.
Yeah, exactly. So, speaking about things that might impact our stress or help us relieve stress, a lot of people use caffeine in that sense. But can you talk to us a little bit more about the impact that stress has on our health and maybe how it might show up for different people?
Mhm. Oh, I think it's huge. I think that this is one of the most, I think we've had this big wave of understanding the impact of sleep on our health the last few years with people like Matthew
Yeah.
Walker and, Ariana Huffington writing books about it and sharing more of the research and how big of an impact it has on health. But I think stress is sort of like this next thing where it's so highly underestimated the impact that it has on our health because the culture that we live in just rewards go 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 all the time, and the way that we live with technology and we're always on, and we've just sort of gotten into this habit of always having stress. It's impacting us and it's impacting our health, and it's so I think it's so counterintuitive for people nowadays to be able to rest and to understand the value of rest and go into a more parasympathetic state. When we're talking about stress, we're talking about that fight or flight nervous system, the one that was activated, evolutionarily when you were being chased or you were in danger, but then we were able to downregulate and into a more safe state. And so many of us now are in that fight or flight state almost all the time, whether it's because of the environment that we live in, because we're constantly being stimulated, or maybe because of past like subconscious traumas that have happened, so that your nervous system just doesn't know how to turn off. And so the impact of working on healing from those things and also helping to put yourself in an environment where you can relax and you can turn that parasympathetic system on is so important, because when our sympathetic nervous system is turned on, we feel like we're being chased by a tiger. And what we would do if we were being chased by a tiger is, we'd be mobilizing, we'd be taking blood supply from our GI tract and putting it towards our muscles so we can run away. Our cortisol would be high, our blood sugar would be high, so we could provide fuel for our muscles to be able to run away. Our immune system would be activated because we're getting ready in case we get like a cut or an injury that we need to heal. And so that becomes the chronic state that we're living in, where we have this, inflammation, this immune system activation, elevated blood pressure, elevated blood sugar, we're having lack of good digestion, and that becomes the chronic symptoms that we're living with day to day. And it's so surprising. We often think about exercise and nutrition as being the biggest contributors to these things, especially things like insulin resistance or blood pressure. But, stress is that silent factor that I think plays a much bigger role than most people think. So it's something we work with all of our patients on at Wild Health. We're really big in trying to downregulate. I think HRV and using an HRV tracker is a great way to do that in an objective way if you're a data kind of person. But that can also add more stress for some people too. So,
Yeah.
Whether it's meditation, whether it's, going for a walk in nature, breath work, there's so many different ways to work on, just helping your nervous system feel safe and going into that parasympathetic state. That's really important for all of our body systems and for our health in general.
Yeah, I love that you said that. And that sort of really beautifully mirrors something that I always say, is that stress, I feel, is the most underappreciated or under recognized cause that is driving dysregulation in our blood sugar. And,
Mm-hmm.
We can sort of like say ... and other chronic health issues. So,
Yeah.
because I'm focusing on blood sugar mostly, but that it's so impactful. And like you said, people kind of show up like they have all these markers of this high stress. They're not digesting well, they have high glucose, because it's like their body is just, the stress state is clicked on, because their vagus nerve is also so not, it lacks tone, that it's not able to put the brakes on this system. And
Mm-hmm.
the idea, like all the things that you talk about, I talk about that as well, about, the breath work and going for a walk in nature and being social in a group of people and connection. And these things are so important. But I find that this is, for me as well, the hardest thing to change, because
Mm-hmm.
it's easy for me to be on the go, for me to always be checking things, for me to always be moving and grooving, and I'll do this, I'm scheduling this, I overschedule myself. And then it's like, oh, you need to take a break. It's like, well, I feel like I have too many things to do, or like I was just sitting wasting time on stupid Instagram, and that's not rest,
Yeah.
right? We know we're sitting, but that's not rest. And then we put on Netflix, again, not rest.
Mm-hmm.
So
Mm-hmm.
what do you think? Do you have any tips for changing our behaviors and helping people to, create new habits around taking time to actually do the breath work, do the walks, do the whatever practice is going to move the needle forward in helping our nervous systems regulate and come more into balance?
Wow, that's a tough question. I think it's so different for every person. And, for me personally, I always knew it was important. I would try meditation. I would do, use different apps where you meditate for 5 or 10 minutes a day. And I played with those. And sometimes I was consistent, sometimes I would fall off. But it wasn't until something happened in my life where I really needed to take more care of myself, that I realized the importance of it. And then I was almost forced to spend that time. And now I notice when I don't feel like myself. And so every time I get off track a little bit, it's just a reminder to me of like, wow, it's not worth it. It's so important to be able to have that time for yourself. And whether that's, finding what that is for you. If it's, first thing in the morning and that's the time that you're going to have before the day gets away from you, that's really where I like to spend more of my parasympathetic time, doing meditation and prayer and reading. I think that, even scheduling time to take care of yourself, like go get a massage, go get acupuncture, making sure you schedule time to catch up with friends. I think it's just so important. And if you look at it in the context of your whole life and why you're doing what you're doing, I think it's really helpful too. So many times we can get caught up with these short-term goals of like, oh, I have to finish this project or do this thing or that thing. But if you look at what is, it's sort of the classic, Franklin Covey approach of like, what do you want people to say about you at your funeral? But like, what is your purpose? What do you want to be remembered for? A lot of times it is those things. It's not, doing the extra project at work or like taking care of your chores. It's, the time that you spend with people, the way that you live your life. And so making sure that the day-to-day actions that you're taking are actually getting you closer to that long-term goal, I think is an important thing to think about too.
Yeah, that's really well said. And I do think it's going to be different for everyone. And yeah, that morning time, I feel like I wish my mornings could fill up half my day, because the morning routine that I really want to have is so long.
Yeah.
It's like, oh my gosh,
Totally.
I want to do the breath work, but I also want to go for a walk, and I also want to do the breathing. And it's
Yeah.
like, then the morning, we're in the afternoon already.
Totally. I know. And it's a tough thing because there's so many things to do. And so, when you have a long morning routine, you can feel great. But I found too, it's finding what are the different versions of that. Like maybe on Sunday, you have this like 3 or 4 hour long morning routine and you take a walk and you do yoga and you just have your alone time. But maybe during the weekdays, you have a shorter version that just helps you stay grounded and stay stable and consistent, but knowing it doesn't always have to be like the, long version every single day. That's something I'm still learning and navigating too.
Right. Yeah. It's like, it's like all of a sudden I want to get my morning routine in check. And then it's like, well, I want to do all these things. I want to have all these benefits. So I always try to, and I'm saying this because I'm sure that there's someone else out there who struggles with this too. Maybe some people just think I'm crazy, but it's like, okay, I want to do a morning routine. Well, what do I want to put in there? It's like, well, I need to do the walk and the this and the this and the this, because these are all important. I can't just choose one. But then you bite off more than you can chew, and then it goes away. So, James Clear, Atomic Habits, he talks about doing habit stacking and just doing one little thing. He says, start with something really, really small so you can master it, like 2 minutes of meditation or 30 seconds of meditation, because he wants you to master the habit of sitting down or laying down and then going on with your day. So if you can master that, or he says like, go to the gym for 2 minutes. And it's ridiculous. You're like, well, I'm already at the gym, so I might as well work out. But he wants you to get in the habit of actually getting there. So I love looking at those sort of habit tricks to help, instill those new changes.
Totally. And I think it is this process, like we talked about already, it's this process of experimentation. It's like figuring out, okay, when I wake up and I feel this way, like I have a lot of thoughts going on in my head, I'm going to journal today. That's what I need. Or like a different day, you might need meditation, or a different day, you might need to go for a walk, and knowing that you don't have to do the exact same thing every day, but kind of checking in with yourself and seeing what you need and experimenting with that. And not beating yourself up. Like, I think so much of it is just like celebrating the small wins, like you said, the little things, and not beating yourself up if it's not the perfect morning routine every day, just celebrating what you do.
I love that. And I love that you mentioned that, because I had forgotten I wanted to say that sometimes I almost feel like, and especially for people who kind of feel like that would be boring to do the same thing, or like you feel kind of constricted by the thought of you have to do the same thing. It makes you not want to do it. So having like a menu of, you can journal, you can meditate, you could do a guided meditation, you can do some yoga, you can do qigong, you can do breath work, you can do tapping, like get your menu and be like, what am I, what feels good today? And maybe that's something that might draw you, because for me, the thought of sitting down to meditate, sometimes I'm like, it doesn't make me feel
sometimes
that great.
It's too
like,
much. Yeah.
Or like, that's just not what I'm feeling right now. And instead it's like, I want to go for a walk. I want to do this. I want to go see the sunrise. I want to, journal. So I love that idea of also, committing to the time where it's like, you could fill that space with anything that your body is really feeling. And it's going back into that premise of listening to your body. What's going to feel good right now? And sort of checking in afterwards, getting in touch with, oh, how does it feel after I journal? Like, wow, that really felt like a good release. That felt really helpful versus, okay, I sat down, I did this guided meditation. I didn't really feel anything. I felt much better with the breath work. So knowing thyself is so important, to knowing like, this is going to keep me motivated. This is going to move the needle forward. And
Yes, absolutely. Absolutely. And just like having kind of fun with it and not being too regimented. I think it goes a long way.
So good. So thank you so much for all this information. I really love I'm excited to check more into Wild Health, because you're going to have a new patient soon, because I know that I need to maybe do some blood work. I don't know. It's been since like maybe 2016 2016 that I've gotten full blood work. So yeah, a
Oh,
little
we can help you
overdue,
out there for
little
sure.
overdue. But yeah, I'm really excited. So can you tell everybody where they can find you and where they can find Wild Health?
Sure. So you can learn more about Wild Health at wildhealth.com. And we have a discount code for you and for your listeners, Danielle 10. So that'll get you 10% off of all of our services for people who are interested in checking it out. And you can follow Wild Health on Instagram, Wild Health at Wild Health MD. And then my own Instagram is at Julie Foucher, JuliefOucher. And we also have a podcast, Wild Health, the Wild Health podcast too.
Awesome. Very cool. I'm definitely going to be checking all this stuff out. I'm really excited. And thanks for being here today and taking your time out to talk to us.
Thank you, Danielle. It was so great to meet you and
Yeah,
chat with you. I loved it.
you too. All right. Bye-bye.